Welcome everyone. And as people are still joining in, we will start with some questions. So we'll put some poll questions for you, and you can just answer the questions. The first question. Okay, so thank you for answering these questions. We'll go to the next question. Yeah. So are you currently preparing for CPHQ examination? Planning in future. Most of you are doing planning in future, so that's great. So those who are planning in future, it will be a very beneficial program for you. And those who are doing it already, it will help you. Yes. And you can still join our regular courses. Next question, please. What is your role in the organization? So we see that most of you are uh, nurses and doctors. Okay. Some are administrators too. Pharmacy also. Okay, fine. What is the biggest challenge in healthcare quality for you? Okay, great. Thank you. So now we will start, and we'll start with the agenda. Just give me a moment.
Introduce you to the agenda also, and to the organization, and to myself as well, before we start. And as we are waiting, so more people have joined. Welcome. 25 more people have joined in the last 2 to 3 minutes. So welcome everyone. And we know that it takes time, little some time to join the sessions. especially on a weekend. So we were just waiting for you. So don't worry, we have not started. So these are, I will introduce you to the modules. We will cover some basic statistics also today, data analytics parts, tools and techniques, FMEA, if possible, we will cover, and also we'll show a project from a hospital. So the whole idea is to give you uh, a fair idea about first what CPHQ is, what are the different modules you are being tested. And after that, we'll start with that for 30 minutes. We'll cover that part. Then after that, we'll talk about some systems thinking, especially from senior management perspective. And then after that, remaining last 1 hour, we'll talk about some tools and techniques which we use in quality and especially the healthcare quality. About the organization, we have been enabling individuals and organizations achieve excellence since 2006, and more than total 5,000 CPHQ certifications, more than 5,786 CPHQ certifications have happened through the our organization in the last 20 years. And I'm proud to tell that last 15 years, I've been the main trainer for CPHQ training programs and Lean and Six Sigma programs for Anexas. So welcome. More than 150,000 people have been trained professionally and issued certification in project management, Six Sigma, CPHQ, and also healthcare quality. Some of my credentials, I have been conducting training programs for the last 25 years in quality related. Primarily, I started in Europe. I'm a permanent resident of Australia, but most of the time I'm roaming around. And today I'm in Riyadh. I'm addressing you from Riyadh. I just arrived early in the morning. It was a late night flight and I did not sleep properly, but yeah, I'm still there for you. Okay, and these are some of the training programs. I also take pride in telling that I conducted the first ever Lean and Six Sigma Black Belt training program in whole of Middle East. And that was back in 2007 and 8. And that was the first certification in any of the Gulf countries. And I'm proud to tell you that I conducted the session. And that was this certificate. Biggest hospitals around the world, they are our client, King Fahd Medical City, Beijing Hospital here in China, and National Healthcare Services in UK, medical services in Australia, and lots of Dr. Sulman Habib, then the JCI Hospital, and also the I think all the major hospitals, and I would say Riyadh, the International Medical Center, KSUMC, and so many, even Ministry of Health of Saudi Arabia, they are our clients. And a lot of JCI accredited hospitals, they are our clients, because in JCI, one of the clauses to apply Lean and Six Sigma techniques or any statistical techniques, and we have done this quite well, and we have got excellent case studies and lots of awards we have won. This is National Healthcare Service, where we have for 10 years, I have been consulting in National Healthcare Services. We have done lots of projects, especially, those, once you get introduced to CPHQ, we talk a lot about quality tools and techniques. And one of the major quality tools and techniques is Lean and Six Sigma. So this is quality is not only about learning, it is about applying. And best way to apply the quality tools and techniques to the benefit of the hospitals and the healthcare is to do improvement projects. And we have got PDCA approach, Lean Six Sigma approach, Lean approach, and we have got 8D approach, lots of approaches. And we learn Kaizen also. We learn everything in CPHQ. And this is just an example of how quality delivers money. So this is well, we have Alex with us, and he has done excellent Lean and Six Sigma projects in National Healthcare Service and in hospitals. So Alex. So these are the people who get trained like the way you are getting trained in quality tools and techniques. Then they do the projects and then they show the benefits. Would you like to tell us something about it?
Hello, I'm Alex Wells, Head of Service Improvements at the Royal Liverpool University Hospital. I've been really fortunate to present today on how us as a trust are using Lean and Six Sigma principles to deliver better care for our patients. I've presented today on a lot of the work that we've done around how we've improved patient outcomes, reducing mortality, improving length of stay, and also talked about how we can actually realise some financial benefits from that. Over the past 2 years, we've been really fortunate that we've done some good work, and it's actually delivered us £2 million worth of quality efficiencies through delivering better patient care.
So one of the biggest expectations from a CPHQ is that you should deliver some money. Who's the CEO of King Edward VII Hospital in London. And anyway, I've got lots of videos, credentials, etc. I'll not.
On 21st of May 2000,
In many cases, how to reduce the nosocomial infections using the tools and techniques which you learn in CPHQ. Dr. Tarif Alama, the health minister, and Dr. Mohammed Abdul Ali, who's the health minister of Saudi Arabia. They are all participants of our trainings. So with that, once again, I would like to welcome again 30 more people have joined in the last 5 minutes. So now what we will do, we will start the session, and we will be just to tell you, this is a webinar, so you can write and you can write your questions also. There is a Q&A, plus also in the chat box you can keep on interacting. I may not be able to reply to all the questions during the session, but towards the end I will try to address all your questions. So come to Saudi Arabia again, please. Waleed is telling, I'm in Saudi Arabia. Right now I'm in Riyadh. Yes, Mr. Waleed. And yeah. And we have got Wafa. Okay, which quality frameworks, Lean Six Sigma, pretty are most effective in Gulf region healthcare? Lean and Six Sigma. Lean and Six Sigma is the most. And I've personally, I have guided more than 2,500 projects in the last 25 years in Gulf only. And please connect with me. Because you have asked this question, Wafa, I would try to show you a project. I don't know how much time it will be, but we'll learn the tools and techniques while we apply an improvement. We'll do an improvement. We'll imagine that we are doing a project, and we'll show you that. Mark is Mark, welcome. And my team will be answering the administrative related questions. And there is a certification for this course also. And by the way, when you attend our full CPHQ program, the 4 days of programs which we hold on Saturdays, every Saturday, sometimes in the evening also. During Ramadan, we hold it in the night as well. So once you attend that, you will get a certified healthcare quality expert certificate. And after that, after you appear for the CPHQ examination, you get a CPHQ certificate. So what I will do is, rather than, as I said, you must have realized that I am very much there. Okay, Canada. Okay, Unaza, Kolia, you're watching from Canada. Okay, it's 3:45 a.m. here. Okay, well, special welcome to you. And a lot of people from US also watch this program, and also they have got certified. And there are two types of CPHQ examination. One is for US and one is for outside US, means they call it as international certification. So there is a minor difference between the two. And all of you, I would say, are telling about, or most of you are right now so-called international students. Okay, it is conducted. CPHQ exam is conducted by NAHQ, which is National Association for Healthcare Quality. And it's a floating certified population, means 18,000 to 19,000 approximately. Why? Because every 2 years you have to recertify. So some people just get certified once, and then that is good enough for them to tell the world that they have passed the CPHQ examination. They don't recertify. That is why this remains a floating population of around 17,000 to 19,000 people at given time. But I can say more than 70,000 people have been certified till date by NHQ. And personally, I have certified. My students are 5,000, numbering in 5,000. And overall, our organization, because we are doing this training for last 20 years, they have, I think, more than 11,000 to 12,000 people have got certified. CPHQ incorporates the body of knowledge. And rather than, I'll just tell you a little bit more in detail about the modules, but some more information. It is about an examination. We prepare you for the examination. Now, when we say we prepare you for the examination, more than the examination, the best benefit you get is you learn some excellent quality tools and techniques using which you can improve your processes. And that is the best thing to happen, because when you can improve your processes, your career improves, your manager is happy, your CEOs are happy. So that's what the best benefit I would say from this program. Apart from that, of course, if you appear for CPHQ examination, you get a certificate as well. So there is a CPHQ examinations. We have got preset questions. There are 140 questions. 140 questions you have to answer. Out of that, only 125 questions are scored questions, and 15 questions are pre-test questions. Pre-test questions means they will not be scoring on those questions. But where are these 15 questions? You don't know. They are hidden in the 140 questions. So you have to answer all the 140 questions, thinking that every question is a scored question. Now, why this information is important? Because the 15 questions which are hidden somewhere in these 140 questions means that you should not spend too much time on any one question, because sometimes people make this mistake of spending too much time on one question, and maybe it's not going to score. So better to answer all the easy questions first, and after some time, once the time remains, you can come back to the questions which you find it as difficult questions. So that is what just wanted to tell you. This is just simple information. I will not go into too much of details about the exam, but very, very briefly, I'll tell you that if you pass the CPHQ examination, you can add CPHQ, Certified Professional in Healthcare Quality, as your against your name. We also conduct, by the way, apart from CPHQ, we conduct PMP certifications, Lean and Six Sigma Green Belts, Black Belts, and Master Black Belt certifications. We are also authorized to issue the certificates of project management and Lean and Six Sigma Green Belts and Black Belts. Relatively, Lean and Six Sigma Green Belts and Black Belts is easier examination, easier to pass. And apart from that, we have got Power BI, etc., etc. Some of you are asking that question. That is why I'm just answering that question. Okay. Now, coming back, what are the modules? So these are the modules. So there are 6 modules. Okay. First module is about quality leadership and integration. It is about ensuring that leadership understands what quality is, and who will make them understand? A CPHQ professional, a certified professional in healthcare quality. You as a CPHQ are supposed to engage your senior management so that the quality becomes the strategic objective of your organization. So how to make it happen? This is what this module is about. It will tell you how to assess the leadership in strategic planning, how to create strategic plans. It also identifies how to establish the priorities. There are so many things a hospital can do, but how to prioritize which activity is important, what is the most important objective, how to prioritize them. That is what we learn here. And then we learn how to align the quality and safety activities with the strategic goals. Then nothing will happen without the stakeholders. Stakeholders means the people who are positively or negatively impacted by the activities of an healthcare organization. Stakeholder means whoever stake, like shareholders are also stakeholders, employees are also stakeholders, the patients are stakeholders, the relatives of the patients are stakeholders. Stakeholders means any person or any organization or any group which is getting impacted by the activities of the organization. And here we are primarily talking about the quality implementation. So who are the stakeholders of our quality implementation? There are senior management is definitely one of them. If the senior management doesn't support, nothing will work out. So how to engage the senior management, how to engage the managers, how to engage the employees. This can happen through a lot of training, consulting support, and also as a certified professional in healthcare quality, you are an internal consultant to the organization. So how to become one, you come to know about it. That was our first module. The second module, usually when you see, so these modules are given by NAHQ, which conducts this training program. And the numbers 19 items means 19 questions will be asked from first module. Similarly, okay, let me, rather than describing the module, let me first take you through the modules and then I'll come and describe these modules in detail. So first is quality leadership and integration. There are 19 questions. Second is quality review and accountability. There are 16 questions. Then we have patient safety. There are 18 questions. And then we have regulatory and accreditation, 8 questions. And performance and process improvement, 27 questions. And data analytics is 26 questions. So these 5 and 6 are very, very important. Almost 60%, 62 questions. If you add them together, approximately almost 60 questions are coming from these two chapters. So today I will emphasize a little bit more upon the tools and techniques of these two chapters. Having said that, of course, I'll try to cover almost 1 or 2 tools from almost each chapter. Population healthcare, health and care transitions, there are 11 questions. So now we have understood there are 7 modules, and we start with, I just described, very, very briefly, I'll describe these modules. Then we will take up maybe a little bit, I will talk about the leadership, and then maybe I'll jump to the data analytics part and the process improvement part, which constitutes almost 60 questions. Quality review and quality and accountability talks about the clinical pathways, the documentation, practitioner performance evaluations, patient experience, and also maintaining the confidentiality of the performance and quality improvement records and reports, as it is very, very important, confidentiality in both patient records as well as the quality improvement records. Also implementing and evaluating the quality initiatives that impact the reimbursement. Then patient safety, you learn lots of tools like FMEA, failure modes and effects analysis, apart from a lot of other tools. And then this constitutes 18 questions. Regulatory and accreditation, how to get accredited to accreditation body. Like, for example, by the accreditation body, you have JCI, you have Sabahi in Saudi Arabia, NABH in India. Every country has got their national accreditation body, and mandatorily they have to get accredited. And how to get this accreditation as a CPHQ, what is the process of accreditation, you will come to know. And that's what we learn here in this particular chapter. What is the whole process of accreditation? Then performance and process improvement. The best way to improve in our healthcare organization is to do projects. So we understand what is a project, what is the difference between process and project. What is a process? Process is something which is done every day, every time, repetitively. Like for example, treating a patient is a process. Discharging a patient is a process. So process is something which you do repetitively, again and again. What is a project? Project is done once, only once. Probably I can say once in the history of the world or the universe. It happens only once. Means it has a starting point, it has an end point. It doesn't exist after some time. A project doesn't exist after some time. So what you do, and here what you learn is how to apply project approach to process improvement. So here you learn lots of tools and techniques, how to implement the quality improvement training, how to train the people, what type of training you should provide. Here you learn Lean, PDSA, Six Sigma, different tools like fishbone diagram, scatter diagram, box plots. You also learn about control charts. And that's what we are very, very thorough expert in it. Our trained people in CPHQ, they don't find any difficulty. In fact, these 60 questions become the most easiest question. They are considered to be the most difficult. The 60, the data analytics, the statistics is considered to be the most difficult part of CPHQ examination. And our students find it the easiest one. So sometimes they say, oh, patient safety and other things. See, generally patient safety, no one fails. Leadership also, no one fails most of the time. But people say that the data analytics part was so easy because you know that I am right. When you say questions related to analysis or statistics, they're so simple. They become so simple. and you know the right answer. Sometimes in a leadership program, safety related programs, there could be 2-3 answers which are correct, and it's very difficult to understand which one is the best answer at times. But the statistics becomes the easiest topic for our students, and that is why we are, we are called masters in this game, and we train you on all these things. Today, I will take you through some of those tools and techniques in that area. Then you have healthcare data analytics. Here you learn mean, median, mode, standard deviation, what are control limits, process under control, process out of control, what are structural process and output measures, SIPOC, the systems thinking, the value stream map, etc. All these tools and techniques you learn. And here, then you also do the measurement analysis, some correlation, what is the some of the introduction to hypothesis tests. Although if you want to learn about hypothesis tests in detail, you should join our Lean Six Sigma Green Belt and Black Belt training program. But it's in CPHQ, they don't go into the details of that. You're not, you're not expected to go too much of details in hypothesis, but a little bit of introduction is needed, and we provide you that as well. So in fact, I can say we train you much more than what is expected from you by the CPHQ examining bodies. So you are on a stronger stage, you're on a stronger platform, I would say, and you can pass the CPHQ examination very easily. Then we have got the last module is about population health and care transitions. How, as a CPHQ professional, you can contribute to those, to the population health, and also the care transitions. It's also very important to take care of the care transitions. So how you can do it in the best possible way. That is, the chapter talks about this. Well, so I'll start with the, let's say, as I promised, I'll cover a part of leadership, because some of you said that leadership is a big challenge. So see, first of all, the challenge is that leadership is busy with lots of stuff. And as a quality professional, it is your responsibility to align the leadership with the quality and quality objectives. So you have to develop systems thinking. Maybe probably I'll cover systems thinking today from this. And lots of videos I have created. You can always subscribe my channel, Anexas channel, or company's channel. It's not my channel, it's a company's channel. So you can subscribe to Anexas channel. And there, in that channel, I've presented lots of topics in 5 minutes or 6 minutes, but described in much detail. So you can always, go through that. There is a CPHQ, one particular folder is there, which is related to CPHQ, and you can always watch these. When you join our training program, a regular training program of 4 days, you get all the material, all the videos, and of course the online session like this one, and the video sessions, video recording of those sessions also, and plus of course a lot of mock exams also. Okay, so let us start with systems thinking. Systems thinking is okay, let me explain it rather than taking the slides. Let me explain it. See, I'm trying to make a map of every healthcare organization. It could be a hospital, clinic, lab, a medical university, whatever. See, always you have something like, okay, let me, the color. So some people do not see that. So it's putting, yeah. So think of your organization, hospital, university, and if you are a student, then university. There are certain inputs, and these inputs get processed through series of steps or departments. These steps are performed in the departments, different departments, and you have an output. Yeah. This is a typical model of any organization of the world, yeah, including yours. And we are producing either a service, output is either a service or a product. Okay. And output is consumed by the customer. Okay. Output is consumed by the customer. And suppliers are providing the inputs. Based on the feedback received from the customers and also demand prediction, which we predict, we have a strategy team or the senior management team, strategy team, planning team, planning team, senior management, governing body. There are different names for this. They make changes and changes to the processes, like they can inform the departments that were based on the feedback from the customers. And we need to change our, process parameters, we need to speed up, or we need to reduce the errors, or we need to do things in a different way. So this whole thing, what you are seeing here, we call it as a systems map. Systems map. It was given by Dr. Deming, systems map. In NHQ syllabus, you have to study that quality gurus also. Like Dr. Deming was a quality guru. He contributed a lot to the quality. Now, I don't have too much time to talk about him, but yeah, very briefly, he gave us the systems map. But he said that the problems are not in the people. Problems are in the system. Problems are in the processes. That means when a nurse commits an error in the hospital, or any employee, it could be doctor, administrator, anyone, commits an error, that it is not due to that particular employee. It is due to the processes. It is due to the systems. So he said 85% of the problems, 85% of the errors, delays, or dissatisfaction of our customers, maybe here the patients, is contributed by the processes, and 15% is only contributed by the people. This is process system. I'm not writing it, otherwise it will take time. So I want to deliver as much as knowledge to you in the two hours time. So I'll not write too much. I'll just speak. So here, 85% of the problems, issues, errors are due to the systems. Now, that is why the senior management, starting from senior management, not only senior management, everyone in the organization, but definitely the senior management should have a systems thinking. We should have a systems thinking, not the silo thinking. What is silo thinking? Silo thinking means, well, I belong to department A, okay, and someone else says, I belong to department B, I'm belonging to department B. I'm doing my job. You are sending me some tests to me. I'm delivering these tests within 30 minutes time. As per the KPI, I'm happy. I don't care what's happening in A. I don't care what's happening in C. But the patient, but the customer is not making the judgment about your efficiency, about your organization based on one department. The patient is making judgment based on the process. This is known as a process. The patient or your customer is not making, building your brand, or thinking about your organization, or making a what is impression about your organization, good or bad, not because of one person in the hospital, but because of the processes. So all the processes should be aligned, and we have to have process thinking, systems thinking, and that is why senior management should think about the systems, not the silo. Silo means I'm in my own silo, in my own department. I hope you understood, and thank you. Data and certificate will be awarded. Mohammed is asking. Okay, I think my team will keep answering this question. Nandini is telling, please cover statistical process control also under HDO. Okay, statistical control. I will try. If you are willing to stay for half an hour more, I will cover it for sure. Yeah, so all of you, if you are willing to stay for half an hour more, towards the end, I will also talk about statistical process. And in fact, there are 3 to 4 questions in CPHQ examination about control charts. Yeah, so in case you are willing to stay, why not? Great. Thank you. Thank you for keeping interacting. I'll keep seeing the chat box on and off. Now we have understood the systems thinking and taking forward. We have to create, we also call this as value stream map. Value stream map. We call this as value stream map, VSM. Okay. Now in the value stream map, you will always find some of the steps are value added, and some steps are non-value added. Non-value added, we call it as waste. We call it as waste. In Japanese, we call it as muda. Okay. So as a process excellence expert, as a CPHQ, you have to identify the waste in the organization and the processes. Briefly, I'll talk about waste. Maybe I'll start with the topic of the waste, which is generally dealt within lean. So maybe I'll start with that immediately after this topic. But are there any questions in the systems thinking? Yeah. So you have to have systems thinking. That is one. You have to develop systems thinking in the senior management leadership and also in all organizations. So one of the best ways to do this is using SIPOC approach. C, S for suppliers, I for inputs, P for process, O for outputs, and C for customers. We call it as SIPOC. Make SIPOCs of all departments. People will develop the systems thinking approach. So that is one way. One tool, I just told you one tool. It is about developing system thinking in the employees. So as a quality professional, this is your job to develop these kinds of systems thinking within your organization. You have to train the people. Okay? And when they are synchronized, like synchronized in the sense, let me take one more example. Let's say, well, due to lack of time, I'll not give you too many complicated jargons, but just I'm just taking a very simple example. Let's look at your patient arrival rate in your hospital. Let us say patient, I'm just taking an example. The number is just some number. Let us say that in your clinic or in your one department in the hospital, every 5 minutes a patient is arriving. Every 5 minutes means you are getting around 12 patients per hour. Okay. Now some of the big hospitals say, oh, come on, I'm not getting 12 patients, I'm getting 120 patients. So even that can also be dealt with. But right now, take a simple example. Now, 5 minutes. Okay. If it is taking 5 minutes, now if I design my whole process, that step is taking 5 minutes, everything is taking 5 minutes, every step is taking 5 minutes. Just imagine and try to imagine. I've got a very good video also, but when you join our programs, we have full video explanation. I don't know if I can pull this out for you. Let me try to pull this out. Sometimes, I have a habit of deviating and giving too many details. My team keeps telling, keep it high level. But at times, you become too enthusiastic. So let me show you that video also. Yeah. So here, if I just, or I will just tell you that we have videos. I'll just show you. This video is very much available in our Anexas YouTube channels. You can have a look at it rather than I giving you details here, because it will take a lot of time to talk about it. So this video, you can just line balancing. This video, if my team can, Toyota, I think it is about flow, establishing flow. If my team can find that video, you can please do, please put it in the chat box, and it will really help us to, circulate this video to everyone. Yes. Video is about explaining the same thing, what I'm explaining to you, but it is explaining in detail. It is explaining lots of things like how to calculate your tact time, how to calculate your, uh, value added and non-value added steps, etc. Very, very good video, simple to understand video, very, very simple video. Try to do that. Another one more video you should watch is FMEA, failure modes and effects analysis. Please do that. My team will put FMEA. In fact, even if you don't watch this flow video, there might be 1 or 2 questions, but FMEA, there are 4 to 5 questions. Please watch that FMEA video for sure, because there is no time for me to teach you FMEA here, but it's a 15-16 minute video. It teaches FMEA to you in a taking a simple example, very simple day-to-day life example. And then I have shown, I think, one healthcare example also in that. So if time permits today, and if you are willing to stay longer, I can even cover that. So one more, as I said, promised control chart, I will cover after 2 hours. Then I can cover FMEA also. If you are willing to stay for beyond 2 hours, I'll cover FMEA also. But if you don't have time to stay here beyond 4 hours, 2 hours, then please watch this FMEA. FMEA video, for your kind information, it has been watched by more than 2 million people. So it's a 2 million views it has got. So I'm proud to tell you that it has got a 2 million views. Okay, anyway, so like coming back, so I did talk about the system thinking, and these slides are describing exactly what I just told you. And okay, let me talk about a little bit of the waste in the system, waste, and how to identify the waste in the hospital. So I told you to watch this video for flow, but if I were to just very briefly tell you the same thing. See, if I have got every step is taking five minutes, every step is taking five minutes, typically what you will see? You will see that there is no waiting time. There is no waiting time in the whole process. Means imagine one patient, total processing time remains 20 minutes, right? The patient will experience 20 minutes of stay time in the hospital, but he's not waiting at any point of time. Please remember. And imagine every 5 minutes of wait, a patient is coming. So there, as soon as this patient finishes the job, another patient comes and he gets processed in the system A. It could be like triage, it could be blood test, it could be an X-ray, whatever it is. If we make our processes balanced, there won't be any waiting time in the whole system. And this philosophy is known as establishing flow in the process. But in reality, what happens? In the reality, A is taking 5 minutes, B is taking 15 minutes. Now imagine what will happen. There will be a queue here, waiting time. Waiting is a waste. Okay. Or it may also happen, let's say, B is taking 5 minutes. Okay, another example I'm giving. One was B is taking 15 minutes. Then patient will wait. There will be a queue. And C is idle. Idle means they are free. They're not having any job. But they're having job, but they're waiting. So you will put 3 people in department, or 3B, step, whatever is the step number B, you'll have to have 3 Bs so that the line becomes balanced. I hope you are understanding. I'm trying to give you this knowledge in a shortest possible time. So not sure. If you're not understanding, please let me know in the chat box. If you want some more explanation, I'll be happy to give it to you. Okay, concept of flow. This whole thing is very, very nicely, slowly explained by me in this particular video. Please watch it at your leisure. Okay. So please do that. Well, great. Now coming back. Lot of waste is there, like waiting, errors, transportation. This we call it as waste. A CPHQ professional can identify these wastes and help reduce the waste in the hospital. Just to give you a simple example. So now let me give you an example. Some people understand using the examples. So let me show you one. Yeah. So there are 7 or 8 types of waste. Waste of intelligence, waste of scrap rework. If you want to remember, you can remember like I swim too. I swim too. Yeah. I swim too. I swim too in the river of waste. That's what the people say. So intellect means waste of intelligence of the employees. You keep doing jobs which are not using your intelligence. I'll give you some examples. In short while, I'll give you examples. Scrap, rework, waste, defects, waiting, inventory, motion, transportation, overproduction, overprocessing. Let us take some examples. Okay. When we are doing our systems map, first we identify the value. What is the value for our customers? Okay. First, you understand what is the value. See, why we are doing these activities to provide some value to the customers. If I go back to my system here, see, for the customer here, in our case, our primary customer is the patient. What is the value patient is asking for? What is the value patient is asking for? The patient is asking for better health, improvement in health. That is the value. Now, some of the steps are adding value, some of the steps are not adding any value. Which steps are adding value? The steps which is related to checking the patient, checking the status of the patient. But those steps which are like walking, waiting, or you commit a mistake and then you correct it, they are all wasteful steps. But surprisingly, these steps are very much part of our processes. Sometimes they are built in the process, they are designed in the process. That is why we see problems are in the processes, not in the people. Yeah. I will take, before I proceed further, I'll just explain these problems are in the process, not in the people, by taking a simple example. Let us say this is a hospital. Okay. This is a hospital and 1,000 people are working in this hospital. 1,000 people are working in the hospital. Ask any employee of the hospital, any staff member, what is your target of making mistakes today? Okay. Or how many customer complaints, patient complaints you would like to, what is the target of patient complaints today? No one will tell that, well, today I want to commit 10 mistakes. Collectively, we will produce 50 mistakes, 50 errors, or 50 customer complaints. No one is going to tell you. But as they are entering at, let's say, 9 a.m., they are coming to the hospital, and 5 p.m., they are leaving the hospital. I'm just taking an example. There are shifts. I understand there are lots of shifts, but I just take a simple example, right, for a particular department. In the evening, you will find 50 errors have taken place, 50 customer complaints have taken place. Or it won't be 50, but it is somewhere. If you look at the last the 100, 200 days of data or 180 days of data, you are always between, let us say, 35 to 65. Means if you look at your customer complaints data or error data or any data, it could be, patient waiting time also. See, the data is data. It's a number. So you become a master of this data and statistics and statistical analysis. When you learn your quality tools and techniques, you become a master of this. So this 35 to 65 is your process performance. As if these 1,000 people who are entering into this hospital, they have a target. They have a target to produce on an average 50 errors or 50 mistakes, 50 complaints, or let's say if you're talking about patient waiting time, 50 minutes of patient waiting time. That's their target. As if. But when you ask anyone, they don't have this target. But who is producing these customer complaints? Of course, our system, my dear system, is producing. System comprises of processes. You can change the processes and bring the performance, like here in this case, if it's customer complaints, to let's say 0 to 10. You can do it only through process improvement, not due to no amount, no reward, no punishment will ever achieve this 50 to, let's say, on an average, let's say 5 errors or 5 customer complaints is our target. No award, no reward, no motivational speech, no threats, no punishment will ever achieve this. Only process excellence. And you learn the tools and techniques. You'll have to find the root cause. You have to collect the data. You have to find the root cause. You have to first understand what is how to measure the performance of the process. Because you are totally new to the subject, I'm not using jargons, but some of you are, I understand some of you are preparing for the exam, or they have got some a little bit background. For you, for those, I can say this 35 and 65, they are called as control limit. We call it as a lower control limit. Lower control limit. And this is upper control limit. That word control is little confusing in nature. It doesn't mean that we are trying to control our complaints within 35 to 65. It's not, doesn't mean like that. Okay, that I think I could have changed that name, but Sheward, Mr. Sheward, and he was the teacher of Dr. Deming. He gave these names, so we have to go with these names. These are known as control limits, and we call it as control charts. They just tell you the performance of the process. We can call it as voice of process. This is voice of process. Process like customer complaints process in our organization. It is between 35 to 65. Waiting time of the patients, 35 minutes to 65 minutes. For the last 3 months, 4 months, 1 year, 2 years, we are like that. This is known as voice of process. Every process has a voice, and you can collect that information by collecting 30 samples. If you collect 30 samples, you will get the average. Patient waiting time is 50 minutes. And standard deviation, I'll not go into the details right now. Standard deviation is 5 minutes. Those who are aware, they will know. So what happens? Every process got an average. Every process has got standard deviation. And 99% of your data of the population from where you have got the sample is within plus minus 3 times standard deviation. So it is so easy to get the control limits of your process. It is not difficult. Just go and collect 30 samples. Like if I want to know the patient waiting time, just collect 30 samples. You will get an average. You will get the standard deviation. And you find that it is an, when you join our course, we'll tell you, it's just in Excel sheet. They will not ask you in CPHQ examination to calculate standard deviation. Please understand. There are no calculations. You should know the concept. Yeah, you should know the concept. They'll not ask you any, because nowadays everything is like easy to calculate. For example, let's say if I have a patient discharge time, let us say, patient discharge time in hospital, let us say, and we'll do this project in a short while. We'll start this project. I collect some 15 samples of patients being discharged. In the last, randomly, I collect 13, 15 samples, easily using Excel sheet. Here, I'm using Minitab. There are lots, all tools are available free of cost nowadays. Average in Excel sheet, you can calculate the average. Standard deviation also you can calculate. And it will tell you 300 minutes is the patient discharge time. Standard deviation is 25 minutes. So plus minus 3 times. Plus minus 3 times. 300 minutes. 325, 350, 375. And here 275, 25 minus 25, 250 and 225, yeah. So approximately our patients are being discharged in the hospital within these limits. Now, some of you, if you are getting confused, let me take a simple day-to-day life example. I think that will help you to understand this. Okay. But before I proceed to the simple example, I will reiterate the problems are in the systems. So every process has got an average. Every process has got a standard deviation. And every process has got a control chart, the control limits. And you have, as a quality excellent professional, you have to change the control limits. And how to change the control limits? You can become an expert by using some tools and techniques. And that is what you learn as a certified professional quality expert. Now, some of you, first of all, would you like me to explain this in a little bit more detail example, or you have understood this? If you want, I have a very simple example also. I have got a very day-to-day life example that let me cover that. Okay.
Very little over. It should be action. You can expect me to travel to information. So if you want to change, if you want to make changes, travel time from my home to office every day. And the idea of what is control chart, let us take a simple example. Suppose I collect the data of my travel time from my home to office every day. And I find that on an average, I'm taking 30 minutes and standard deviation is 5 minutes.
So now, right now, I'm not telling you how to calculate standard deviation. It can be easily calculated using Excel sheet. So let's understand that it is very easy to calculate. Just one click, you have the data. I just now calculated, right? Average and standard deviation. Very easily it can be calculated. So what is more important from your perspective is you should know that one Mr. Goss, he found, one Mr. Goss, he found that all the processes in the world, any process means any repetitive activity. Any repetitive activity in the world, it follows a distribution like this. You will have an average. Average we represent using X bar. You will have an average always. You will have an average always. Right now I'm taking an example of time taken to travel to my office, to the hospital every day. Average is 30 minutes. Average is 30 minutes. Standard deviation is 5 minutes. Okay. Mr. Goss, he found, and this is true in nature, he said that if you collect 20, 30 samples, 30 samples is what is good one. If you get the average and standard deviation, you can predict about the whole population. Population could be 1,000, 10,000, 15,000, 1 million, 1 billion, doesn't matter. There's the beauty. You can predict about whole population. That is how in healthcare it is very much used. Using samples, you predict about the population, isn't it? He says that within plus minus 3 times the standard deviation, you will always get 99% of the total population, 99.73% of the total population within plus minus 3 times standard deviation. Now, standard deviation, you have to find out. Average, you have to find out. Now, just now I found out that average for my traveling time was 30, but it was not always 30. Sometimes I'll take 31 minutes, 32 minutes, 35 minutes, sometimes. So 35, 40, 45. But you will always find that I'm almost never going beyond a particular number. And I'm not going beyond this side also, a particular number. How will I get that number? Using Gaussian theorem. My average is 30. This is plus 1 times standard deviation. This is plus 2 times standard deviation. And this is plus 3 times standard deviation. So 30 becomes 30 here. 1 times standard deviation becomes 35. 2 times standard deviation becomes 40. And 3 times standard deviation becomes 45. I hope you are understanding. Are you with me? Are you with me? Are you with me? Yeah. And here it is 25 minus 1 times standard deviation, minus 2 times standard deviation is 20, and minus 3 times standard deviation is 15. So are you with me? If you have not understood, please let me know. I'll be happy. I'll be happy to explain. No issues. We have 1 hour of time. Yeah, don't worry. We have 1 hour time. Yeah. So what is happening here is, as per Gaussian theorem, I'm repeating, as per Gauss in 17th and 18th century, he gave us this magic formula. Collect 30 samples from a process. Just 30 samples from a process, any 30, 40 samples. Get the average. Mean, average means mean. Get the standard deviation. Very easily you can get the standard deviation. Don't worry right now about it. You can easily get it. I just showed it to you. Excel sheet, there is a formula also. Don't worry about that right now. But because they will not ask you anything like this in CPHQ examination, how to calculate standard deviation. But you should know that average does exist. Standard deviation of a process does exist. And using that, you can predict about the whole process. Like this is your your traveling time. So now this is my traveling time, let us say. You can predict about my traveling time for the whole year. You can say, Mr. Amitabh, 99% of the time, you will take not less than 15 minutes and not more than 45 minutes. Means 99% of the time, you will be taking between 15 to 45 minutes. Doesn't mean that equally you will take 15 to 40. So most of the time, you will take 30 minutes. Most of the time. Sometimes you will take between 30 to 35 minutes. Sometimes between 35 40 minutes. Very few times between 40 to 45 minutes. Almost never. Almost never. It doesn't mean never. Sometimes it may happen very few times. But 99.73% of the time, Mr. Amitabh will take between 15 minutes to 45 minutes. So if you want to predict performance of Mr. Amitabh tomorrow, if someone asks how much time he's going to take to travel to hospital, it will say, well, I can say 15 minutes minimum and 45 minutes maximum. So if you want to schedule a meeting with me, and you know that I start from my home at 8 o'clock, although my average time is 30 minutes, you will not schedule a meeting at 8:30. Yeah, you will schedule a meeting because maximum I will take at 8:45. So you will schedule a meeting at 8:45 and you know 100% I'll be there, right? So this is how you can sometimes make KPIs also. So when you want to promise your, let's say, patient waiting time, I know my patients are waiting for 30 minutes on an average. Standard deviation is 5 minutes. I collected the data of 30, 40 patients at random. Now I know my patients will never, minimum they have to wait for 15 minutes, minimum. And maximum they will be waiting for 45 minutes. So I can promise my patients, within 45 minutes, we promise to serve you. The patients like this. We say, you will be taken care of within 45 minutes. From where I'm getting this number? From KPI, where I'm getting? From my normal distribution. We call this as a normal distribution. Okay? Normal distribution. So I think one of you had asked for control chart. So I'm giving you control charts now only because now I was in the topic. So let me finish that part. Then I will come to the process improvement part also. So coming, because that question was there. So I thought, and there are 5 to 6 questions on control charts. 5 to 6 minimum, sometimes 8, 9, 10. And people get confused. See, these are the difficult parts of your CPHQ. The other part is like leadership, training, accreditation. They are very, very simple topics. No one fails in those. People fail only in these topics, which I'm now covering right now. I'm covering the most difficult part right now. Yeah. Although my team keeps telling me, CPHQ, my company, the marketing team, they say, because you should be very simple. You take simple topics, you can make people happy. Take leadership related topic, patient related safety related topic, etc. And then people will think that this training is easy, and then they will come to the training, and then you teach them the difficult topics very slowly when they are in the classroom. But I have a habit of going to the most difficult topics. Sorry for that, but I think some of you will get the benefits, even though if you're not joining our session. Of course, we would like you to join our sessions. We have a 4-day training program. Saturdays, every Saturday we. I'm talking about myself. There are lots of other trainings we have got, but CPHQ training is conducted by me every Saturday. We have got every month we launch one CPHQ badge, and it is not only that it's just not only 4 days. You can attend our session any number of times. Once you enroll with us, any number of times you can attend. And plus, if you have any questions, you can write to me in person. So I give you my WhatsApp number also. So you can write in person if you're doing your exam question preparation. If you have any questions, you can also write to me at any point of time. Or there are other people, also trainers, to help us when to answer the questions if I'm not available. So for question and answers, when you are attending our sessions or later on also, you have a online support on WhatsApp group. So you can because it's difficult, and you will get all the videos also. The video which I'm showing you, you get all the videos. So just to now recap, just have a recap or whatever I just said.
And we know how to calculate the standard deviation and how to calculate the average. Now, if I plot the data on a histogram, then lower control limit would be -3 sigma limits, that will be 15 minutes, and upper control limit would be 45 minutes, that is plus 3 times the standard deviation. So lower control limit being 15 and upper control limit being 45, I can say that my travel time is going to vary between 15 to 45 minutes. So you can expect me to travel to my office every day between 15 to 45 minutes. If someone asks me...
So I hope up to here you are with me. Just let me know. Up to here, you understood. Yeah. I'm giving you 5 to 6 questions of CPHQ examination right now. So be very, if you don't understand, please ask, no issues. Although this is not a regular session, but it is an introduction problem. But yeah, still do ask. So I hope one of you were telling me to revise it. So I hope you up to here you are with me, right? Okay. Now let me jump to the, let's go ahead. Let's go ahead. So here, what's happening? I have got my control limits, means my traveling process is between 15 to 45 minutes. If my boss looks at my performance of coming to the office every day, if I take one day 20 minutes and next day I take 25 minutes, if my boss asks me why this difference is there, the right answer would be, this difference is unexplainable. See, generally what do we do? We start giving answers. Oh, there was a red light, this problem was there, I got stuck there, traffic jam, this, that. But in statistics, we say that as long as you are between lower and upper control limits, this is your common cause variation. This is your natural variation. Natural variation means this is how your process is going to behave. This is what my traveling process is behaving. This is the voice of process. And if my boss is monitoring my process, he will say, well, yesterday you took 20 minutes, 25 minutes. Yeah, you are under control. It doesn't mean that I'm happy with you. It doesn't mean that. See, when we say process is under control, it doesn't mean that the boss is happy with my process, or my patient is happy, or my customer is happy with my process. It just means that process is behaving in a predictable manner. So my boss has predicted and he knows that I take between 15 to 45 minutes. And as long as I take between 30 to 45 minutes, he'll say, well, 15 to 45 minutes, you are behaving as. But statistically, if you ask me, uh, our answer would be something like this.
Minutes. That is plus 3 times the standard deviation. So lower control limit being 15 and upper control limit being 45, I can say that my travel time is going to vary between 15 to 45 minutes. So you can expect me to travel to my office every day between 15 to 45 minutes. If someone asks me why this variation between 15 to 45 minutes is there, I can tell him that it is due to common cause variation. What is common cause variation? I can say that the variation between 15 to 45 minutes is due to lots of factors. These factors can be the traffic on the road, the weather, the car I use, my mood, or it can also depend on at what time I start from my home.
So, in other words, I can say that traffic has a small variation. Every day traffic varies. Route also, there are 2-3 routes. I take different routes. Weather varies. Mood also varies. Starting time varies. So collectively, all these variations. Sometimes the car also may vary. Maybe imagine that I've got 5-6 cars. So anyway, car means car condition may vary right here. So all these additions, adding everything together, all these additions of this variation is producing variation in the process, which is the total variation. We call it as common cause variation.
So a lot of factors, which we can call it as X factors, are affecting the travel time, which is the Y here.
So in statistics, whenever in statistics, whatever problem we are trying to solve, we designate it as Y. Like patient waiting time, patient discharge time, nosocomial infection rates, whatever you want to improve, we call it as Y. And the factors which we feel are the causes of this particular problem, we call them as X factors. Please remember this. This is the Y, this is the X factor. Okay. So now we are trying to look at the relationship between the X and Y.
So I can make the statement that the variation between 15 minutes to 45 minutes is due to the common causes. Means all the causes are acting on my system and producing this variation. This is known as voice of process, as if my process is telling, my traveling process is telling that I will take between 15 minutes to 45 minutes. Now, if I take 60 minutes to travel to my office, then same question is asked to me, that why did I take 60 minutes, then my answer won't be that all the causes are acting on my system and producing this variation of 60 minutes. I might be able to point out a cause. We call it a special cause. So I may say that I took 60 minutes because maybe today there was too much traffic on the road, or it can be any factor.
It could be some reason like, today my relatives are visiting from another city and I wanted to take them around. So it could be anything. But it is that special cause is something which is not happening every day. It's a strange thing. It's a special thing. Yeah. We call this that process has gone out of control. Here we say process has gone out of control. So this is one way of looking at process, whether process has gone out of control. Now in the examination, what they will do is, it's very simple. Although you understood, it took a lot of time, but they will just say, they'll ask a question. Is the following process in control or out of control? So the answer is, it is out of control. Okay. But there are other ways of doing process out of control also. If the process increasing, say it should be random. It should be random like this. If it is not random, but increasing, even though you are between upper and lower control limit, still there is a trend. If there is a trend, means something special is happening in the process. If you don't take an action, it will go out of control. So even this process is also out of control. So suppose I'm taking one day 20 minutes, 25 minutes, 30 minutes, 35 minutes, 40 minutes. Oh, my boss will say, well, till now you have not gone out of control, but I look at your trend. Something is going wrong with you, Mr. Mitab. And he'll say special cause. So whenever there is a special cause, either this is also an example of special cause. Another example of special cause I'll give you. Going up, down, up, down, up, down, up, down, up, down. Oh no. The actual random process should be up, up, down, 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 up, down, something like this. But if you're up, down, up, down, up, down, up, down 14 times, oh, there is some special cause. Something special is happening. Okay. You look at the patient data also. Blood pressure low, up, low, up. Every half an hour it's going low, then up, then low and up. You'll say patient is not stable. But if it's random, we call it stable process, stable, under control. Right? Stable, under control, predictable. And please remember, process under control does not mean that customer is happy. Process under control just means that you are behaving in a predictable manner. That's it. Okay. Means, for example, let me tell you, let's say your patient waiting time is, patient waiting time, let's say patient waiting time. Is 35 minutes, your 50 is 50 minutes is your patient waiting time. Standard deviation is let's say 5 minutes. So your patients are waiting in your hospital between 35 to 65. Are you happy with it? No. But process of patient waiting time is under control. But you are not happy with it. You would like to change the control limits. Because there is one more limit which is called as specification limit. Specification limit. It is given by the customer. We call it as voice of customer. Yeah. Customer is telling, I can't wait for more than, let's say, 30 minutes. Currently, you are giving me 35 to 65 minutes. Although the process is under control, but patient is not happy with it. This 30 minutes is voice of customer. Customer could be your management, customer could be your government, customer could be your patient. These limits are given by your customers. Okay.
So when I go out of control limits, I can specify a special cause. And we call this variation as a special cause variation. So we have two types of variation: common cause variation and special cause variation. Common cause variation is part of the process, part of the natural variation of the process. And special cause variation is assignable variation. I can assign a cause to that particular event.
Now you will ask me why we are learning about this common cause, special cause. Yeah, there must be a question. Now, this is a very, very important question for process improvement perspective, because the people in the hospital or healthcare industry, they get confused with common cause and special cause. Okay. So first, let us understand, we have to treat these causes as differently. When there is a special cause, we have to take immediate action. Immediate action means, as a manager, you have to take immediate action. Like, for example, my boss found me, I'm taking 60 minutes. He says, what happened, Mr. Amitabh? Well, you know, my brother came from another city and he is staying with me. He wanted to go around the city. My boss will say, sorry, Mr. Amitabh, tell your brother to go around the city himself, but you are an important person. You have to come on time. So boss is taking action. Okay. Because if he doesn't take an action, process will go out of control. But suppose process is under control, then I have to look whether process is satisfying the customer or not. And if not, I have to change the control limits.
Now, what is the difference between common causes and special causes? For special causes, you need to take immediate action. Means you need to take a prompt action so that you are able to bring the process within control. But for common causes, you should not take any specific action. Usually, the common cause is within the control limits, and if you want to act upon the common causes, you might have to change the control limits, and changing the control limits takes effort. You may have to do a DMAC project. You may have to do a lean project. You may have to do a Six Sigma project, and that's what we are doing. That is why we say that lean and Six Sigma is applied to chronic problems. A process is behaving in a certain way. It is behaving within some control limits for a long time. Last 6 months or 7 months, your procurement time has been, say, 120 days plus minus 30 days. And I would like to change the control limit. I would like to change the DNA of my process. And that is why I would need to do a Six Sigma project. To understand the
If I just take an example here, like my patient waiting time is 15 minutes to 45 minutes today, and I want to reduce it, this change is going to happen only through some good efforts. And some of the efforts, and one of the efforts which I will now tell you today is statistical tools and techniques. We also call it this DMAC approach. Okay, you can use lean approach, you can use Six Sigma approach. See, actually, all approaches are more or less same. PDSA approach, Kaizen approach. If you learn, if you become a green belt or a black belt in Six Sigma, you learn everything. But as a CPHQ, a little bit of lean, a little bit of Six Sigma, a little bit of PDCA, everything is a very, very little minute dose of that is taught to you. So here, what we are aiming at here is we are going to change the control limits. I want to reduce my patient waiting time from 15 to 45 minutes to, let us say, 0 to 10 minutes. And this shift is like changing the system. It's a systemic shift. It's a systemic shift. And you have to really take some good effort. It is not going to happen just by me have a meeting. Yes, let's have a meeting. Let's reduce. No, you have to apply some tools. Now, some of the tools I will just demonstrate. I'll just give you now. I see the purpose here is not to teach you the tools. Purpose is because right now in short period of time you can't learn or you cannot do with me. But when you join my sessions, we do it together. We do it slowly. We take more examples. We do question and answers so that you master these things. But right now I'm just giving you the glimpses. So taking you back to this example, which I stopped, and I think I just wanted to give you a little bit of, just give me 1 minute. How to remove this? Okay, anyway. Here all drawings. Yeah, gone. Yes. So you are looking at the value. And I was telling, see, everything comes back to the systems thinking always. Those who joined a little late, you can see the recording. I see 10, 15 more people have joined in the last half an hour. If you have, don't worry, you just see the recording. I've explained all these things, right from the beginning. So now I want to look at the value. Value is what patient wants. Patient doesn't want to fill in a form. Patient doesn't want to walk in. Patient doesn't want to give his ID card in the morning. It is not adding any value to his health. They are all waste for this patient. So you have to identify the non-value add activity in the whole process. And patient or the customer makes a judgment about your process through measures on your output. We call them as KPIs. Some of the KPIs like infection rate, waiting time, patient discharge time, length of stay, they are all measures. Measures, we call it as KPIs. Some KPIs we are doing good, some KPIs we are not doing good. Where we are not doing good, we need to take improvement projects. So we have to follow approach of Lean and Six Sigma or PDSA, Kaizen, one and the same. The tools and techniques remain the same. And now let me take you first to the waste, how to reduce the waste. Then I'll tell you how to do a DMAC project. It's just for demonstration. Very, very quickly, I'll be taking you through this. The purpose is not to teach you in detail. The purpose is just to show you the glimpses. So first you look at what is the value. Value here for the patient is, I want to know the health status. Now you are telling me to walk, then register, then walk. They are all wasteful steps for me. They are waste. Only two added, value added. Draw the blood and test blood test processing. Tell me the result. I'm interested in that. This is known as identifying the waste. A waste of intelligence, another waste of intelligence. Nurses, the 80% of the nurse calls are housekeeping in nature. Means patient says, my pillow cover is dirty, my bed sheet is dirty. Now this is waste of intelligence of nurse. Nurse is there to take care of the patient, give the right medicine, monitor the health of the patient. If you give all this job to the nurse, it is waste of her intelligence. There are different people for different jobs. Another example, again, I can tell you some more. Could be like surgeon is waiting for the operation theater to get ready. Now, there is a slide there, but instead of searching for it, I'll just tell you. See, by applying these tools and techniques, you can improve lots of stuff. These are our real case studies. Yeah. We can double the cardiology lab capacity, reduce the diagnosis to exam time drastically, cut the admission, reduce the signatures. A lot of approvals are not adding any value today. These approvals were needed 10 years ago. Now these approvals are not needed. A lot of your processes, they don't know when they were designed 10 years ago. You have a WhatsApp today. You have AI today. But still you are doing certain steps unnecessarily. Reduce the waste and create the value for the patient or the customers. Let me also give you some more examples of waste. Unnecessary process or motion, unnecessary waiting, unnecessary transport, errors, unnecessary stocks productions. Yeah. Person who's sitting idle or overutilized, both are wastes. Equipment which is underutilized or idle, both are waste. Cost of a 5-minute MD walk, waste. Walk to elevator. So if you calculate all these numbers, say cost of elevator wait per day per nurse comes out to be $12. And if you have got 200 nurses multiplied by 365 days, it runs into millions of dollars. So much of waste is there in our system, just to give you an example. Yeah. One more thing, as a Lean Six Sigma professional, CPHQ professional, you learn is there's something called Poka-yoke. Poka-yoke means even by mistake, you cannot commit a mistake. So you have some Poka-yoke mechanisms which you can develop, for example, so that mistakes or errors are reduced. Yeah. Some examples like indented surgical instrument tray, so that you don't forget anything inside the patient's body. Asking questions in a hospital, where is this department? Where can I get my report? These are waste. Waste the time of the patients, waste the time of the staff also. It should be visual hospital. You should be able to see everything. Yeah. Poka-yoke is like, something like rice cooker. Even by mistake, the rice will not get burnt. Similarly, you have got some examples here. Smart machines cannot be set nor operated beyond normal safe maximum levels. Yeah. Abnormal ranges will be rejected automatically. Oxygen or nitrogen cylinder cannot be connected to each other, even if you want to connect, because the connections are different. No, even by mistake, you cannot commit a mistake. Pokayoke in Japanese means foolproofing. Uh, Foolproofing means even a foolish person cannot commit a mistake. Even if you want to commit a mistake, you cannot commit a mistake. Some more other examples are here. Yeah, fixed number of gate packages, watch packages, and complete catheter care crates, etc. So, okay, so now this was about the waste part. Now let's look at the process improvement, a project. Let us do a DMAC project. Let us do a project. Okay, I'll just show you a very quick project, and if time permits, I will also show you some detailed projects. Now, use of those tools and techniques in a little bit or more detail. But first of all, again, going back to Dr. Deming, he also said one more thing. You cannot measure if, you cannot improve if you cannot measure. He said, you cannot improve if you cannot measure. Yeah. So, and yeah, CBC is in the hematology lab. Yes, you're right. Yeah, that's, yeah, right. The blood test processing, right. So, now looking at this, do you agree that everything can be measured? Or there are certain things? First of all, do you agree everything can be measured? So Mr. Dr. Deming said, you cannot improve, you cannot measure. But can you measure everything? If you can tell me, can you measure everything? So some people are telling yes, some people are telling no. Yeah. So let me give you now a trick to measure everything. Okay. So let me tell you, you can't improve if you cannot measure, and you can measure everything. Now, how? You will ask me how. So there are two types of data. Okay. There are one type of data is continuous data, and another is attribute data. Please remember, there are two types of data: continuous data and attribute data. Data are of two types. Continuous data means something which you think is easily you can measure, and the attribute data is that data which you think is difficult to measure. Like waiting time. Waiting time is continuous data. Yeah. 30.2 minutes. 30.2 minutes means you have a unit and you have a possibility of a decimal point. Blood pressure, weight, height, these are all examples of continuous. Attribute data is something which we feel is difficult to measure. Can you tell me any one thing which is difficult to measure? So I'll tell you the trick to measure. So some people are saying emotions, happiness, hatred, pain, yeah, all, yeah. So I'll tell you how to measure everything. So you have to design the measure, survey, yeah, patient survey, satisfaction survey. Yeah. So attribute is, let us say, so some of you have said happiness or satisfaction. So let's say happiness. You can replace this happiness with satisfaction, emotions, whatever it is. The second step is, once you have written down your attribute, you create categories of that attribute. A simplest category would be presence or absence of that particular attribute, like happy, unhappy, satisfied, dissatisfied. Emotions, you get anger, happy, sad. No, you can have multiple categories also. So I'm just taking an example of happiness right now. Happy, unhappy. Let us say I'm trying to improve the happiness of our employees in the hospital. I checked with 100 employees and I found, and I understood that 60 people were happy. They said, I'm happy. And 40 people said they are not happy. So proportion means out of one. Portion out of one. Let's imagine this is a circle. This is one. Proportion means out of one. So this becomes 0.6 and this becomes 0.4. Yeah. This is 0.6 and this is 0.4. Okay. Oh, sorry. Sorry. I was on mute. I don't know till I'll repeat it. I'll repeat it, not to worry. So uh, did I talk about this? Was I available here when I'll repeat it, not to worry. So this, what I was telling is, this is the trick. I just showed you the trick to measure. I showed you the trick to measure happiness. So I asked people that from proportion, okay, from proportion I missed out. Okay, fine, thank you, Mark. So yeah, so here from proportion I missed. So proportion, we have proportion means portion out of one. One means this is a circle. Circle is one, so 0.6 belongs to happy and 0.4 belongs to unhappy. So I can say 0.6 proportion of people are happy, and I want to increase this proportion 0.6 to 0.8. Or in percentage, percentage means the circle, if you imagine, is 100. Then 60 belongs to happy people and 40 belongs to unhappy people. So proportion is actually used in statistics, not percentage. Okay. But it is the same thing. Proportion, percentage is the same thing. Now I can say that 60% of the people are happy today in my hospital, and I want to increase the staff happiness to 80%. And then I can do the improvement project. So first thing is, we define our problem, then we measure our problem, either using continuous data or attribute data. When you are using continuous data, you will always use histogram or whatever we just saw, that normal curve, average, standard deviation, like waiting time, average. When we are using attribute data, instead of using histogram, you look pie chart, or bar chart, happy, unhappy, or patient satisfaction, no, very, very happy, neutral, unhappy, extremely unhappy. Now, those some people are asking about, they would like to learn about standard deviation, etc. I will give a link. So we have got a lot of links, and you can watch that, how to the standard deviation part. You can, if you are interested in, they will not ask you any question there, but if you are interested, I have explained the whole derivation of standard deviation in detail. So my team will put that thing there. So now if I go back to my measure of our attribute data, I will use bar chart. So here 30 patients said very, very happy, 40 said happy, 10 said neutral, 5 said unhappy, and 2 said extremely unhappy. So this is the way of expressing our attribute data. Okay, this is the way of expressing our attribute data. So the type of data will determine which type of chart you will use. So the exam will give you some charts like bar chart, and they ask you questions. Pie chart, ask you questions. They'll give you some histograms. They will ask you some questions. Okay, but once you understand the concepts, it's very easy. Another thing, when we are doing improvement project, you would like to know, there are interrelationship between the X and Y factors, right? Factors like, is my waiting time? See, waiting, if I want to improve my waiting time could be due to multiple reasons. Okay, let me show you actually a project, very typical project. Let's say waiting time example. So here, most of the processes, they use DMAC approach: define, measure, analyze, improve, and control. DMAC, we call it as. First, we write a project charter. Okay. So here they have written a charter that for the last 6 months, the total time spent is this much. And we would like to reduce it to 93 minutes to 30 minutes we want to reduce. Okay. Now, don't go into the details of this project because it will take a lot of time. The idea is to show you the whole approach. First, you start with the process, high-level process, CPHQ. We call it CPHQ: supplier, input, process, output, and customers. How does the process look like? What is the Y here? Y is our input. What I want to, Y is our output measure. They are known as outcome measures. Measures on the outputs are known as outcome measures. Measures on the process are known as process measures. And measures on inputs are known as input measures. We also call it structural measures. Measures on suppliers input, they call structural measures. Structural measures, process measures, they deliver the outcome measures. Again, some questions are there on outcome measures, process measures. What are process measures? They'll give you some examples. And what could be the possible process measures of this outcome measures or something like that. Okay, then we create our histogram. We get our average. Sorry. Here it is not mentioned. We get a control chart that I will show you in using another example. So and then we find out in the analyze phase, we do a cause and effect diagram. We call it as fishbone diagram, also known as Ishikawa diagram. What are the possible causes? So we teach you how to create a cause and effect diagram in our training programs. But in short, you brainstorm on all the possible causes. You can also use a very good brainstorming technique for improvement called 635 technique. So I'll give you 635 technique video link here. You can watch this video link at a later stage. My team will put that link. But you brainstorm on all the possibilities. Then you do something called as Pareto analysis. Pareto analysis about, actually Pareto, Mr. Wilfredo Pareto, in 18th century, he found that 80% of the money in Italy was with 20% of the people. 80% of the land in Italy was with 20% of the people. He called this the 80-20 rule. And he found that this 80-20 is applicable everywhere. 80% of the crops in Italy was contributed by 20% of the type of crops. Your hospital also has got, if you look at your statistics, 80% of your customers are coming from for treatment of 20% of your total diseases which you are capable of treating. 80% of the customers are coming for 20% of the region. 80% of your patients are patient complaints are related to 20% of your all other complaints. So there are, let's say, 50 reasons of complaints, 50 different reasons. 20% of 50 is 10. So 10 reasons are contributing to 80% of your complaints. This 80-20 rule is applicable everywhere. Okay, Pareto chart. So here is also applicable. 80% of your patient waiting time is due to 20%. Like if you have mentioned 10 causes here, only 2 causes are responsible for. So here we did the Pareto chart. We found that these 2 are the main reasons. And then we act on those main reasons, and then we reduce the time. So this is a typical DMAC approach. In the improve phase, you apply the improvements, and then control phase, you maintain that whole thing. This is our typical control charts. You are able to maintain it for a long time. Define, measure, analyze, improve, and control. Control means sustaining the gains. It should not happen that you go back to your original state. Another example is given here. Okay, rather than showing short examples, let me quickly show you, a worked out example. I want to reduce the patient discharge time. Okay, this is the patient discharge time. We collect the data. We we can make a histogram because it's continuous data, right? We can make a histogram. Okay. And we find this is how our process is performing. And we can also do control charts. They will not ask you to make control charts, okay? But I'm just showing you because that will give you an idea. See, when you see the realities, how the things are taking place, how the things are done, you grasp the thing in a better way. When you see the applications, you understand it in a better way. So now this is how control chart. Now in the exam, they'll directly give you the control chart. But when you know how it is obtained, what is the essence of control chart, you can answer the question. Now anyone can ask you any question on control chart. You will be able to answer at least 25 to 30 questions. It can come out from this control chart. You can answer them easily. Like for example, process is under control. What is upper control limit? What is the lower control limit? You can calculate the standard deviation by like 3 up and 3 down. So you can easily calculate with those values. So it's very easy. Means once we make you, practice that in the classroom, obviously. Then lots of possible causes. We make a cause and effect diagram. Generally, there is a 6M technique we use: man, machine, material, method, measurement, and mother nature and environment. We create let's say, the cause and effect diagram on possible causes of why this patient discharge time is high. Well, there are so many reasons, but which reason is occurring again and again? So we collect the data. We asked, in this case, 2 nurses were asked to collect the data. They noted down the data. So we collected like 50, 60 late when the patients were discharged more than a particular time. So there were so many reasons. Some reasons were occurring again and again, more frequently. So this table you can create. You arrange them in descending order. Nowadays, Excel sheet or any simple software nowadays, they can make this chart for you. It will tell you that, well, reporting was not accurate, was some error in the reporting, then they recorrected it. There's small simple error. This is missing, that is missing, forgot to write this medicine. That is 27 times. Staff was not available 23 times. Pharmacy delayed, discharge summary delay. They are all reasons, top 4 reasons contributing to 80%. This is the cumulative line. First 2 together are contributing to 54%. If you see this line going up, this is the addition, like cumulative line. If you want to know how the chart is created and detailed review of detailed explanation of Pareto is given in my another video. I'll give you that video link. Please watch that video. It's all free for you to not to worry. Yeah. Of course, some people are asking if you want to come and attend our training program. I'll tell you how to attend. Please enroll. We are having a new batch starting very soon. My team can tell you the dates, and I'll be happy to I love training. I love conducting training programs. And I love interacting. Right now it's a webinar, so I can't interact with you. You are muted. But in the classroom, we can have a nice discussion. We can ask questions, etc. So these are our top 4 reasons. And if you see, the percentage contribution is given at the below. So you calculate the percentage contribution. First 2 are contributing to 54%. First 3 are contributing to 67%. First 4 causes are contributing to almost 75.8. So I can just look at the first 4 causes. Take care of those first 4 causes. I'll solve my 80% of my problems. That is how we can. Some more thing, if you, I can also take you, although in such a short time, it's very difficult to explain, but very quickly, I'll try to explain. See, if you want to further analyze, you want to validate, like patient discharge time, is it really impacted by the discharge summary delay? Well, I think so. I may not think so. So here we create a hypothesis. We create 2 hypotheses. Patient discharge time is not related to discharge summary delay, and the other hypothesis is patient discharge time is related to the patient discharge summary delay. Then we either accept or reject our null hypothesis. What is null hypothesis? Always null hypothesis, there is no relation. Null hypothesis, always there is no relation. Let the data prove whether there is a relation or not. I can't say. Using intuition logic, I can't say. So when there are, now discharge time is continuous data. I hope you remember continuous data and attribute data. Summary delay is also continuous data. I hope you remember. Like for example, reporting accuracy, correct or incorrect, it is attribute data. If you remember. So these are our X factors. We want to know which X factor is very significantly impacting our discharge time. Discharge time is our output. Why? And these are our X factors. Discharge summary delay, pharmacy delay. These are our X factors. We want to know, is this X factor, discharge summary delay, impacting the discharge time? Well, I don't know. I have to look at the analysis. Whenever you have one continuous data and another also continuous data, like discharge summary delay, you can always create a chart, which we call it as scatter plot. Scatter plot means this is the Y, this is the X. Here it is waiting time. Here it is discharge summary time taken to make the discharge summary. More the time taken, more is the waiting time for the patient. Means there is a relationship. I'll say yes, discharge summary time is the root cause. But it may also happen like this. It may happen like this. Discharge summary took 20 minutes, till the patient waited for 5 hours. One time discharge summary took 30 minutes, patient waited for 2 hours. Sometimes 30 minutes, patient waited for 3 hours. There is no relation. You finish the discharge summary, writing discharge summary faster or slower, the patient always waits for 5 hours, 6 hours. There is no relation. That means patient discharge summary is not the root cause. Something else is the root cause. Maybe the reporting accuracy. Maybe that is the root cause. Okay. So you have to use scatter plot when you are doing continuous and continuous data. Now in the exam, scatter plot will be given to you and they will ask you a question. Is waiting time getting impacted by discharge summary time in this hospital? Answer would be depending on the chart. I just showed you two cases. Another thing, box plot is there, something called box plot. Those who actually, should I talk about box plot? Okay, briefly I'll talk about it. See, when our data let us say our data here is not continuous and continuous. Like here, our data was, both are continuous in nature. Discharge time and discharge summary, both were continuous data. Now, if I want to know reporting accuracy, is it impacting my discharge time? So when it is correct, it is 300 minutes. When it is incorrect, it is 360 minutes. Whenever it is correct, it is 245. Now, how would I cannot make a scatter plot here because one is attribute, one is continuous. So in such cases, I will make box plots. Box plot means something like this. Waiting time and accuracy. Correct reports are accurate or not accurate. Incorrect. Correct waiting time is like this. Incorrect waiting time is like this. Here, this box is like, here you have, this is median, this is the first quartile, median, third quartile, etc. If you are interested in what is box plot, I'll give you a link in detail. You can look at the box plot, what it is. But when you are in the classroom, we do a proper, I don't find good to, hurriedly talking about it, but maybe I thought that those who are already aware of this part, I will just show it to you. So when it is attribute data, like here attribute data, and this is continuous data. So we use box plot. So let me just finally show it to you this. And also, let me see, discharge time and discharge summary delay. Are they impacting? Well, let us see. First look at pharmacy time. Pharmacy time, is it impacting? Pharmacy time is also continuous data. Time taken in the pharmacy, there is no relationship. Pharmacy time and discharge time, there is no relationship. You don't blame the pharmacy. Even they hurry up, still our discharge time is not going to reduce. But what about the summary time, the patient summary time? Discharge summary time, let us see. See, you have to use the chart and get the result. Oh, yes, it is impacting. Now, I should do something about patient. And in what they did automated. They automated that. See, what to automate, what to not automate. Don't automate everything. It is of no use. No, don't waste the money of the hospital unnecessarily. Where there is no relationship, there is no point in automating. It's not going to impact. Even if you reduce some time, it is not going to impact the patient. Yeah. So you should be like sensible in automating. Discharge time and let's say reporting accuracy. Let me do a box plot here. They will not ask you to do any analysis. They will ask you to, they'll give you the box plot. You have to make conclusions. See, once you know once you know how it is created, etc., you will be able to answer any. I can create 20 questions out of this box plot. Here you can say incorrect, or always it is more, correct, it is less. That means accuracy matters. Means accuracy is related to the patient discharge time. Means you should really work on reporting accuracy, correct those errors. You will definitely, you're pretty sure that you will reduce it. Discharge time. Well, so these were all, I try to give you as much as possible. I'll show you the dates. I think there are some, my team can tell the dates where I'm doing the training. In the training, I'm very slow. Today, I was very fast trying to tell you a lot of things. But in the
These are our upcoming dates for live online training. 4 days training, which is starting on February 28th. The next weekend batch starts on February 28th, March 7th, 14th and 28th, 2026. Or we have another batch starting in April, 4th, 11th, 18th, 25th of April. These are two batches listed. We do have full year's calendar, but right for recent upcoming batches. These are only on Saturdays, and it's going to be 6 hours a day. These are the timings.
These are the timings. Timings also, I'll tell you. KSA time 8:30 a.m. to 4:30 p.m. UAE time it is 9:30 a.m. to 5:30 p.m. India time it is 11 a.m. to 4:30 p.m. and European time is 6:30 a.m. to 2:30 p.m. US it is 5:30 a.m. to 1:30 p.m. So once you join our CPHQ certification, you'll be able to analyze the data, you'll be able to give solutions to your problems, and also you will learn lots of techniques used by the healthcare. And if you're joining us, if you attend our session, you will get a CSQE certificate, Certified Healthcare Quality Expert. That certificate will be given to you once you complete the training. And when you appear for the exam, I mean, you appear for the CPHQ examination, then you get a CPHQ certificate. Also, you'll be also complimentary. You'll be getting a certificate of Lean Six Sigma Yellow Belt certificate also. Okay. So, do you have any questions? If you have any questions, I'll be happy to answer. Yeah, so a lot of people had certain questions, but I think the registration link, yeah, okay. So we'll send you the registration link. Okay, so with that, I think we can close the session and thank you for joining our session today. And this registration link is given here. Uh, yeah, and can you put the can you put the poster here? Yeah. Okay, so um, so these are some of the yeah, these are some of the upcoming free webinars which we'll be providing to you. And these are PMP workshop, CPHQ workshop again, one more time, Yellow Belt training and Power BI training. So see you then, see you soon. And maybe if there are some videos, we can play some videos just in case you are interested in, watching uh, some more tools and techniques and also some credentials. I'll be happy to put up some more videos. And um, if you want, you can stay on for some more time. And these videos will explain certain tools and techniques. Yeah, my team, yeah, I think most of you are asking how to join, etc. So my team will keep on answering these questions in the chat box. So would you like to put some videos? Yeah, or some videos I think we can put up. Yeah, you will be getting a certificate for attending the webinar also, and you will be getting a certificate saying that you have attended Introduction to CPHQ training. This certification link also, we'll be sending it to you in the email.
Hello friends, I'm Dr. Jyoti Bala and I have recently cleared my CPHQ examination with a wonderful score of 88%, and I'm really grateful to Mr. Amitabh Saxena and all his team. So Anexas has done a wonderful job training me for CPHQ exam. I could crack the exam pretty easily. The materials provided were very up to the mark, were very appropriate. I mean, I really had to work hard with them for a couple of months, but it wasn't that difficult as such. And I really wish all the candidates great luck, whoever are appearing for CPHQ examination, and I highly recommend Anexus training for the same. Thank you.
Yes. So right now I just met one person who has cleared the CPHQ examination, Dr. Shahnawaz. And
Yeah.
yes, doctor, you would like to say something about?
Yeah, I am Dr. Shanawaz. I am a family medicine registrar currently working in Saudi Arabia. I got the training from Anexas from Bangalore, and I cleared my CPSG exam 3 years back. It was so grateful for Anexas for training me.
Thanks a lot, doctor, and best wishes to you. He is in Riyadh right now, and we just met him in Riyadh. Thanks a lot. Thanks a lot.
So I've just completed 3 days training of the CPHQ, which has been absolutely fantastic. Amitabh from Anexa has been phenomenal. The course materials have been fantastic. I think what I really enjoyed about this was that I could relate a lot of this methodology to healthcare, and a lot of the examples were things that I could contextualize it with healthcare. So I'm from here in Qatar at Sidra Medicine, and so again, thank you to Amitabh for this fantastic training.
Hello, everyone, future CPHQ professionals. I just want to give you a bit of an idea of our last three-day course on the CPHQ exam preparation. It was awesome. We covered the majority of the topics in a very targeted and focused way that allows us to later on focus our studying and our energy and our time on what really is of value for the examination, but more importantly as well, because of the practical examples that Amitabh was able to provide us in our everyday healthcare work. One thing that I really benefited from the course is that Amitabh from Anexas was able to provide us with answers and solutions, especially at the statistical level, to questions and problems beyond the CPHQ course, to exercises and projects that we do in our everyday work life. For that, I would definitely recommend the course, taking it with Amitabh and Anexas. It's been a great experience, both for my preparations for CPHQ, but more importantly for my everyday work. Thank you so much.
Do not make these mistakes if you want to become a CPHQ professional or pass the CPHQ exam. The theory in CPHQ is totally different than practical implementation. Make sure you are being trained by those who give practical knowledge rather than just giving simple textbook training. It is not an easy test to pass. Determination and hard work is required, along with the right guidance that is provided, of course, by us at Anexas. Each question is designed to test if the candidate possesses the knowledge necessary to perform the task or has the ability to apply the knowledge to a job situation. So prepare accordingly. Learning the statistical tools is very, very important part while preparing for your CPHQ exam. Many people mostly fail in data analytics and performance improvement topics. And of course, Anexas is expert in that. Many professionals postpone the exam by giving some excuse. If you want to be a certified CPHQ professional, plan it, work hard for it, and give the exam. Excuses will not take you anywhere. Hard work will. Walk the journey with us as Anexas and you will enjoy the CPHQ preparation. We humans have a very strange quality. You can call it self-respect, ego, pride, or the will to prove oneself right. This can be a common cause for a rise in conflicts. In an organization where there are many people working together, where some actions affect others, conflicts can occur more than frequently. And this is why conflict management is an extremely important subject to understand so that harmony can be maintained in the company at all times. Let me ask you a question first. Are conflicts good or bad? Well, some of you may say, how can conflicts be good? Over the period of time, views on conflicts have changed. It was an old view that conflict is dysfunctional and caused by personality differences or a failure of leadership. Conflict is to be avoided, or conflict is resolved by physical separation or the intervention of upper management. Well, that was an old view. The new view is conflict is inevitable consequence of organizational interactions. Conflicts can be beneficial. Conflicts is resolved through identifying the causes and problem solving by people involved and their immediate manager. They can also be solved by referring to ground rules framed in the team charter, which was created at the beginning when the team started working together. Let us first understand what are the different types of conflicts. Conflicts can be divided into three main categories: task conflicts, relationship conflicts, and value conflicts. The task conflicts often involves issues related to an employee's work assignments and can include disputes about how to divide the tasks or resources, and also it can include different opinions about the work. Of the three conflicts, task conflict may appear to be the simplest to resolve. However, task conflicts often are more complex than they appear to be and need to be handled carefully. Some of the sources of conflicts are schedules. Someone told you that he will finish the work in 10 days and he didn't. This will result in a conflict. If you see carefully, your team or organization will benefit from this conflict because you are questioning the inefficiency. Priorities. Different people have different priorities. Maybe work that is important for the organization or a project, in your opinion, is not as important for someone else. Resources. We have limited resources. Two people might compete for the resources. Hey, I need that IT guy for 2 weeks. The other person says, sorry, he's not available. There's a conflict. Technical opinions. Technical opinions might be different, which might lead to conflicts. It is always good to explore all the possibilities in interest of the organization, and such conflicts can be good. Administrative procedures. People might not understand administrative procedures and might argue about it. Cost. Someone promised you that he will complete a job within the budget of $5,000, but now there is a cost overrun. Questioning would lead to conflicts, but would benefit the project or the organization. That was about task-related conflicts. Let us now look at relationship conflicts. This type of conflict arises due to differences in lifestyle, opinions, personality, and thoughts. In an organization, people with a vast range of lifestyles need to work together to reach certain goals. These people might not have common viewpoints or opinions, but still need to work in unison. It is obviously no surprise that relationship conflicts can be common in organizations. Value conflicts. This type of conflict arises from fundamental differences in identities and values. For example, differences in political, regional, and ethical thoughts or other deeply held beliefs. These types of conflicts can be difficult to resolve. But as they say, nothing is impossible. So let's see some of the conflict management strategies. Well, there are many different types of conflict management strategies, but I'm going to discuss the 5 major strategies. Before beginning, you must note one thing. Each strategy has its own benefits. There is no right or wrong conflict management style. As long as the style works for you, it can be called as perfect conflict management strategy. The first strategy is problem solving. Here, you confront the problem and solve it by identifying the root cause. For example, to resolve a conflict with a colleague in a project, you might say, well, it seems that the real problem here is not lack of communication, but lack of knowledge of what needs to be done and when. Here is a copy of the project schedule. It should let you understand what you need to know. The next strategy is collaborating. Collaborating involves a combination of being assertive and cooperative. Using this strategy, both sides can get what they want and negative feelings can be minimized. This strategy gives the best results when long-term relationships and outcomes are more important. For example, if 2 people want to lead the same project, you can divide the project into 2, and then you can divide the responsibilities into 2 and ask each of them to lead their respective teams while collaborating. This is a win-win solution. The next strategy is competing. It involves a combination of being assertive and uncooperative, when one aims to pursue their own concerns at another person's expense. This strategy can be used when you don't care about the relationship, but the outcome is more important. We can call it as a win-lose strategy. Like when we play a game, the focus is on winning. For example, when you wish to compete with another company for a new client, this strategy can be used. However, don't use this strategy in your own organization, as the strategy does not help build relationships. Yet another strategy is avoiding. Avoiding involves a combination of being unassertive and uncooperative. You can diplomatically step aside from an issue or withdraw from a threatening situation. This strategy should be used when you don't wish to immediately solve an issue but want to wait for the right time to solve the conflicts. The next strategy is accommodating. Accommodating is the opposite of competing strategy. There is an element of self-sacrifice here. Now, this may seem generous, but it could take advantage of the weak and cause a resentment. This strategy can be used when you don't really care about the outcome but want to preserve the relationship. Maybe this relationship will give you long-term benefits. The next strategy, compromising. It aims to find a convenient and mutually acceptable solution that satisfies both parties to some extent. This strategy involves a combination of being a little assertive and a little cooperative. This strategy can be used when the outcome is not very important and you do not have enough time in hand. For example, to resolve a conflict between 2 persons, you can say, let us do a little bit of what both of you suggest. And the last strategy is forcing. It is about pushing one viewpoint at the expense of another. Do it my way. Or sometimes, as many people say, my way or highway. The bosses often use this. As I said earlier, it's not that one strategy is better than the other. It depends on the situation. But in my opinion, problem solving that means confronting a problem by solving its root cause is the best one, if that is a possibility. Conflicts can be a part and parcel of your daily work, and this is why you should not be afraid when conflicts arise. There are things you can do, such as becoming more skilled and qualified in managing the conflicts. I hope this video helped you. For more videos like this, you can subscribe to my channel.
Happy learning! Thanks for taking out time to watch this video. To learn more, check out our other videos. Link is given in the description below. Subscribe to our YouTube channel and have a great day. For more information you can write to us on inquiry@anexas.net.